Hi, everyone. Welcome to this episode of the Motherhood Show. I am your host, Cheri Bergeron. And today I am super excited to bring back a guest that we had previously. This show really talks about women's struggles in finding romantic love, dealing with infertility, and navigating the path to motherhood on their own terms. And May is Maternal Mental Health Month, so I'm wearing blue in recognition of that. And I'm so excited to welcome back to the show Dr. Ivy Love Margulies.
Hi.
Hi.
Hi, Cheri.
Great
How
to
are
see
you?
you
I'm
again.
good. I'm good.
Great
Thank
to see
you.
you.
I didn't get the blue memo. I would have worn the blue. Or the orange, right? For National
Orange for
Infertility
Infertility
Awareness
Week.
Week. Yes.
Yeah, we've been doing infertility all of April, and now it's really about, in some ways, dealing with all the aftermath. But before we dig into all of that, just share a little bit about Dr. Ivy. She is a licensed clinical psychologist who practices in both California and New York, and I guess also does virtual appointments for people. And she has a incredibly diverse background of hypnotherapy, death midwife, Reiki healer, and she specializes in grief, loss, and trauma that goes across the entire spectrum of women's reproductive and maternal mental health. And this includes postpartum, anxiety disorders, birth trauma, neonatal ICU experiences, miscarriage, infertility, kind of it runs the gamut. And so we're going to dive into all of that today. But one of the things that I think is really interesting about the work that Dr. Ivy does is that she combines and blends different therapeutic methods, including psychotherapy, trauma-informed mindfulness, somatic therapy, cognitive behavioral therapy, Reiki, you name it, guided meditations, just this whole diverse set of practices to really help women, couples, and families in general heal from some of these traumas that they experience. And I also saw that you help counsel egg and sperm donors, gestational carriers, and intended parents. So, I mean, really the spectrum.
True
So,
spectrum. Yeah.
so I'm excited to get into all of that because, you really cover all the difficulties that mentally and emotionally that women and their partners go through when trying to conceive and become mothers, and then really try to be our healthiest selves as mothers on a day-to-day basis. And frankly, I've been through a lot of these things, so I'm really interested to hear your perspectives. But first, what led you to this work? Was there a specific experience that shaped you, or was this just a general calling?
That's a really good question. I think it's multi-layered, or there's several different moments in my life that were significant, where I decided I really wanted to pursue a career in psychology. It was after the death of my father from suicide when I was 15, a girlfriend a year later from suicide. I was married and widowed at 24.
Oh,
He died
wow.
in a car accident. I had a pregnancy loss with him. And after Michael died, I really needed order. I'm in the chaos myself. And so I actually have a background in film and television. I was at Warner Brothers at the time. Before that, I was in fashion. So I've really, really did a big shift
Yeah.
in my focus. And I went back to school. I went back, finished my undergrad at Scripps, went on to grad school, made a documentary film actually as part of my doctorate on sudden loss and young widowhood. And I know the depth of despair and longing when someone you truly are, planning your future and so in love with, and the suddenness of losing that dream and that the love of your life. So I come to this work knowing pain and the depths of despair and trauma and all of the things, right? The grief, all the things that make up my work. And then, I've had more some people get more than others in life. I just happen to get quite a bit of loss and death. So that really shaped really my work. It started in parenting and child development. As I got deeper into my work and had my own kids, I had my own postpartum experiences. I started seeing more women in my practice with their postpartum and their miscarriages, and then their fertility challenges, and needing to go to reproductive endocrinologists. And so my work just kind of transformed and expanded into what I do today.
Yeah. Well, one, thank you for sharing those sort of personal moments that brought you to this, because I relate to that a lot. All that I went through really shaped my mission. And I think that that is really how we evolve as people, and how we're guided through this life, is that we use those experiences for the betterment of others coming after us. And so I think that really helps you have a really keen perspective of what women are going through when they're experiencing all of these things. So,
Mm.
one of the things that I've been learning about recently is unexplained infertility, where there are no answers to why a woman isn't getting pregnant. And I can imagine how frustrating that is. How do you help women deal with those kinds of unknowns?
Yes. In fact, I have several women at this moment that are doing, or it's either secondary infertility, unexplained, or just unexplained infertility in general. It's a big rabbit hole, isn't it? It's searching and questioning, and it's existential, and it's a disruption of identity, and it's so complicated. It's really complex, especially if the first conception was natural and no problem, easy, everything was easy, and all of a sudden it's not. So that's another, I guess, one subset, I guess, of women.
Yeah.
And the other subset is, yes, women who just, they don't know what is going on with their bodies. They feel like their bodies have failed them. Again, that's another, we'll get to that later, how I help them with those kinds of, starts this faulty belief system, really, of blaming themselves, and really just trying to turn over every single rock they can to figure out what could possibly be keeping them from conceiving, and can they conceive, and that is, of course, after we've taken care of and made sure it's not male factor.
Right.
But it's a third. So a third it could be the woman, a third could be the man, and a third can be unexplained. So the unexplained piece is really so incredibly frustrating, because you're again, it's funny when you're in this work, you feel like, oh, it's being talked about and people are understanding, and it's the algorithm on your your Instagram, so you feel like, oh, everyone's talking about this, but it's not true. There are so many people out there who still just are shocked and dismayed to find out that they are 1 out of 6 people with infertility or diagnosed with infertility, and being diagnosed in of itself is traumatic because it's sudden, out of nowhere, and there's nothing you could do about it, and that is the definition of trauma. So it's like the trauma, it's the depression, anxiety, fear, and the unknown is really feeling disempowered and not sure, who am I now if I can't procreate.
Right. And that helplessness to say, we want to know why. And I think there have been so many advancements that we expect that we are going to find out why. And so this
Mhm.
idea of unexplained, I think, is that whole additional layer. There's the fact of not being able to conceive, but then not being able to trace it back to the source is just an additional
Yeah,
complexity, I think. And
absolutely.
and so IVF, of course, as you mentioned, we've been talking about that a lot. And that is a roller coaster of hope and then disappointment in many cases. And I think women feel very powerless when it comes to that their
Mhm.
bodies are being sort of taken over by hormones and procedures. Their life is being taken over by schedules and tests and things like that. And it really takes a toll. And then, who do you really share this with, and who can understand what's going on? So how do you really support women who are going through the IVF process?
Okay. I help women in many ways. I meet them where they're at, right? So every woman is different. We all have different personalities, different temperaments, abilities to handle stress and unexplained news and diagnoses out of nowhere, seemingly. So it depends on who is with me, who am I with. And it's about really allowing them to express themselves, their full expression of frustration, grief, anger, sadness, fear, all the things I kind of mentioned before, and to really help them do something called narrative therapy. And narrative therapy is they're not the problem is the problem.
Mm-hmm.
So to help them reframe that their body is not broken and they're not defective, it can feel that way. I always, of course, want to validate that.
Sure.
And can we maybe say, okay, I'm feeling challenged by the diagnosis of infertility, and maybe we can look at micro things in your life or in your body even that are going well and right. So your eyes still work, your ears still work, your heart still works. You can still walk, you can still touch, you can still talk, there are things, your body's doing so many things that are healthy and well and right. And we have this, women in particular have this ability to just focus on their fertility as their global identity, when it is an organ that is diseased or not functioning for some reason as it's supposed to. And you wouldn't do that if you had a heart problem or a broken arm or, whatever. It's a phenomenon that our uterus and ovaries somehow are globalized to our whole self and identity. So we try to focus on what we can that's going well and right. How do we help you feel empowered in a process that feels so disempowered? And also the disenfranchised grief, as you were mentioning, like, who do we share this with that understands me? Who, men can be, or your partner, it doesn't have to be a man, it could be whatever.
Sure. Yeah.
Your partner can be a great resource of support to a point. There's a place where compassion fatigue comes in, and, they don't mean to give off this, but it's like, not this again. Or do I have to really sit through you talking about this again? Or it's hard to hold space all the time for people that are suffering and feeling out of control, really. And so it's about how do we help this person, the woman, find a support group or other women going through this, and or outlets and ways to connect and share so that people can hear her and listen to her.
Yeah. And I think that partners have another layer, which is of powerlessness, because they aren't on the front lines of it, as I always say. And so there's a helplessness, especially if we're going to talk next about things like miscarriage. And, that is such a brutal experience for both partners. But I think that the person who's not carrying the child feels this added layer of powerlessness because they have absolutely no control. They're not walking in that experience and how do you support someone. So, I was surprised to hear that as many as 1 in 4 pregnancies results in loss. It's between 1 in 4 and 1 in 5. A lot of times we may not even know that a pregnancy is lost. And there are so many unanswered questions about that. And some women deal with recurrent loss, multiple miscarriages and things like that. So What guidance do you have for women who have experienced that kind of loss?
It's really hard and devastating to have multiple miscarriages. Uh, One miscarriage is always minimized as, oh, that happens, that just happens. Um, but it still comes with a lot of emotion and feeling. It's not
Yeah.
something that can just be pushed aside, but it is often pushed aside.
Oh yeah, just go have, oh, well, that's a blip, have another kind of thing. And it's like, I'm sorry, this was a life. I mean, when you hear the heartbeat at 6 weeks,
Mhm,
this is a life, this is real.
mhm.
And then to have that loss.
Correct. The other is to honor every loss that you have with, I believe in naming your losses. Maybe not obviously the baby name you were probably going to give this child to be, but you have to name it something. A lot of people use Hawaiian names or names you won't hear every day, so it's not so triggering, or it can be just something cute and sweet. It doesn't need to be, the actual name. And then a letter. It's important to say a loving goodbye. I call it a love letter to the child that couldn't come through or the baby that couldn't come through, and that it's another way to honor your loss and concretize it, because it's so invisible. It's invisible, and no one knows what you've been through or going through. And many people still, I don't know where this urban myth came from. I think it came from, actually, people are so uncomfortable with death and talking about reproductive loss that we talk about the 3-month wait. And then we share the news. There's still no guarantee, even after 3 months. I believe you should tell someone besides your partner. You should tell one person. That way, if you do sadly lose that pregnancy, you truly aren't alone. It's awkward to have to say, "Oh, I was pregnant," and people are like, "Oh, you were? We didn't know."
Couldn't
And
tell. Yeah.
yeah, when did you know? Then you get all it's very awkward. So I really believe that you should tell one other person besides your partner, if you're partnered, that is.
Yeah.
Um,
Well, let me ask you a
yeah.
follow on to that, because I'm feeling this one very personally, because uh, I had to have a medical termination at 21 weeks.
Mm,
And this was after I had gone through using donor eggs, because I was 40 and we were concerned about egg quality. And so, from my perspective, I thought that I had done everything right and we had gone through the big milestones. And then, you just get blindsided that
mhm,
there's something wrong. And we won't get into the fact that, I mean, that is a very politicized issue now as well. And then certainly in states like Texas, that can be very complicated,
mhm.
to be put to that kind of dynamic. But I did write a letter. I remember writing the letter on my way to the doctor, and I write about it in my book. But I still carry that with me. When you said that, write a letter, it kind of took me right back there.
Mm.
So late term loss can be so jolting. Like you say, you think you're through the the dicey part, the time when
Right.
things can go wrong. You're past the high risk, I guess. And
Mhm.
how is that kind of loss unique in your mind?
All loss is loss. All pregnancy loss is pregnancy loss. Your body has to go through all the same um, physical processes to expel the
Yeah.
the uterus. It has to contract. Your cervix still has to open. You still expel. You still have bleeding. You still have to recover. But yes, we do. Women still compare. Well, your loss was early. Well, your loss was late. Um, I think a later loss, though, does bring, I mean, I think it still brings specifically, special feelings and a unique, other unique qualities, because you felt the baby moving. You watched your belly grow.
Right.
You certainly, 20 weeks, you must have, or 19 to 20 weeks, you're having a structural ultrasound with your maternal fetal medicine doctor to make sure everything is growing well, everything's proportionately correct. They're checking the heart valves, the nuchal fold again, the brain, the ventricles in the brain, the bone length. It's a lengthy appointment. It can also include an amniocentesis if that's something you're wanting. But that's usually where you get even more attached, so to speak, because you're like, okay, we're really, really clear here. Like this, it's looking really good. I'm sorry, Cheri, for your loss, and I didn't know that, and my condolences. It's not something one ever gets over. It is that child to be your baby. It will always be your baby, and you are a bereaved parent. You're a bereaved mother, and it's something that you'll always remember for the rest of your life.
I mean, and I remember so clearly that they told me that the child's condition was incompatible with life, and then they said, "Oh, and by the way, it's a girl," and so it was like, okay, so now I know that I'm going to be saying goodbye to my daughter, that kind of thing. And I'm going into this, ladies, I have been through a lot of therapy. And actually, I wish I'd known Dr. Ivy at the time, because I think she's a phenomenal resource. But I've gone through so much because I knew that I wasn't going to be able to do this work if I hadn't really dealt with the trauma. And we'll talk about that a little bit more, but it still affects you. There are moments, because grief comes in waves. And so some little comment like writing a note can take you right back to that moment. It's really interesting. I didn't expect that. But it's so true. And I'm glad that it's happening on here, because I think women need to know that it's like, oh, I thought I would be over this by now. And the reality is you're never over it, because it's something so significant in your life. This was my first child. And I consider her my first child. I have a memorial stone for her and all of those things. You never get over it. So
I think it's actually makes it a bit harder when it's your first.
Yeah.
If you have a living child, it's still all traumatic. And I think one of the worst losses a person can have in their life ever. But when you have a living child, you have more reason to get up in the morning. Exactly. You have more reason to engage in life and try to find joy again. Exactly. When it's your first, you don't have those reasons.
You wake up to the empty house and have to find a reason to carry on. And so I ended up having kind of a second loss, because I was carrying twins, and my son had a different genetic disorder. And frankly, we never really talked about this, but what we found out was that the clinic had not tested my husband at the time for genetic defects. And this is one of those things that fertility clinics are figuring things out, and they're evolving. But frankly, men should get the full gamut of tests, just the way that women do. And this was an excellent clinic, but I feel that this was an error in judgment on their part, because 2 children carried the ramifications of this. But at that time, my daughter was in the NICU because we had to end the pregnancy early to try to save him. And so she was in the NICU for 40 days. So I know that you talk about prematurity as another big area. I mean, can we talk about how you help parents deal with that? Because I will tell you that 40 days felt like 40 weeks. And at least sometimes it felt like 40 years. And I remember that going to the NICU unit was always past the maternity ward. And I would walk past all of these families that were having the normal experience with their balloons and their cakes. And I was dealing with a daughter who had heart problems, lung problems, digestive problems, all of
Mhm.
this gamut of things from prematurity. So, how do you help women and couples deal with the stress of prematurity?
Yeah, it's a whole nother area, isn't it? It brings with it a lot of feelings of guilt that you delivered early and this baby is suffering, and may not live as well. You're also living on the precipice of like every single nugget of information, data, all the check-ins with the doctors, all the meetings, all the, you're hanging on every word, to see, is she going to be okay, or he's going to be okay, or what, oh, they have to have another scan on their brain. Do they have a brain bleed? Do they have, or how long do they have to be intubated? What do I do with my breast milk? Should I be pumping? When can I give it to them? There's
Yeah.
so many different, you're also postpartum,
Yeah. Oh, by
um,
the way, yeah.
whether it was surgery or vaginal, like you're still dealing with your postpartum body, but you're not even connected to your body. You're so not present with your body. All you can think about is the survival of your child or children. It sounds like you had twins. So um, it's, I mean, you're out of body. You're out of body. You're not present. You're just in survival. You'll do anything to protect and get your child out of that NICU. And yet you're beholden to the nurses and doctors. So there is a lack of control, lack of feeling any agency, a lack of, sometimes you can't touch your babies. Sometimes you can't even,
Yeah.
hold and touch, and you're being wheeled usually there because, you need help if you're still like within days of giving birth. It's all like surreal. It's a whole surreal experience, and your brain just can't take it in. You're in shock. You go through the grieving process as well. It's what can I say? You're doing it day at a time, hour at a time. Sometimes you're hanging on to every, the phone rings, your alarm, it's like an alarm going off in your body. You don't know if it's the NICU or just a regular phone call. And you're afraid to leave the hospital, and, it's a whole, yeah, it's a
Yeah,
whole,
it is. And as you describe it, I can tell that you really understand what all of that is like. And what I remember is they wouldn't let you sleep there. And so like you want to be there constantly, but you can't sleep, you can't use your phone, you can't do all of these things because they want to keep it as quiet an environment. I mean, it's actually really crazy to be in a room full of babies that is quiet. Like that in and of itself is a troubling kind of thing because you're used to, the baby on the airplane that's wow, and all of that kind of stuff. And so when the quiet is almost deafening. So, I
Mhm.
mean, such an important time for people to get support. I appreciate you talking
Absolutely.
about that. And each of these areas, guys, is like a full session on itself. I mean, really, but I wanted to touch on some of these things. And one of the common threads through all of these grief events is the loss of being able to have a normal experience. Like, why didn't I get to have a normal pregnancy, a normal birth, a normal celebration of my child? And I think that comes from this fairy tale that women believe that we're just going to sail through all of this and that this is the most natural thing in the world. And so, how do you help people with that loss? That like, why didn't I get
Well, I
a
would I
norm?
would first, as you're talking, I'm thinking I would replace the word normal, because there is no normal. There's common,
Mm,
but there is no normal. There's also, like you mentioned, the fairy tale or the belief that this is how it goes. You have sex, you get pregnant, you have a baby.
yeah.
Not you have sex, you don't get pregnant, and you have to go to the infertility clinic and have, a team of 6 people around you to get you pregnant, and still no guarantee. And even if you do get pregnant, there's still no guarantee. And then so it's a state of being like in this no man's land, sort of, a holding pattern of holding your breath until you actually get a live baby in your arms. And even then, like in your case, when you had twins, it sounds like one went to NICU and one didn't.
No, they both went to the NICU. My son lived for 19 days and then passed
I'm so
because he
sorry.
was on a ventilator. And, and so, yes, I mean, and I guess
You didn't mention
what,
that. So
no, no, because sometimes it's a lot, right? It's a lot for people. And some of the people who might be hearing this, and by the way, if you want all the details, those who are listening, I go
okay.
into it in depth in my book. But yeah, so that's a total trauma. But I think it's like this feeling of why can't I have what all the people
Sure. You
around me are
can't help but
having,
compare. You can't
Yeah,
help
yeah,
but compare.
yeah.
So, when you have to, constantly gather up the hope that this is going to work, and then it doesn't work, and then you have to regroup. There's a lot of, actually, it brings up shame, embarrassment, and again, that sense of like, is this meant for me? Like you're really wrestling with like, what if this isn't meant for me? And what if I'm not meant to be a mother to a live child, a living child, and bringing in a healthy infant? And it's actually a crisis. You're in crisis, and so there's a lot of crisis counseling going on, and a lot of helping you just to re-regulate your nervous system. Your nervous system is very dysregulated, and so how do we get you back into heart coherence and brain coherence, really, when your brain is overthinking and your heart is not beating regularly? So you're very
Yeah.
incoherent, and when you're incoherent, there's no self-regulation. So you're going to find that your sleep is going to have issues, your eating, your sense of energy, focus, concentration, all the kind of the warning signs. Your irritability is going to be higher. You might go to, not you, but like some people
Yeah,
go to
one. I get it.
substance. One can go to substance use to check out, or engage in risky behaviors, or just shut down completely and not leave the house because trauma, you don't feel safe going anywhere anymore, or you don't want to be hit with triggers in your environment. So the list goes on, but
Yeah, it really
so
does.
the job of what I do is, wow, how do I help you find any sort of connection again with you?
Yeah. Wow. When a woman successfully has a child, so, here I was and I brought my child home after 40 days. I think we try often to bury that grief and trauma rather than dealing with it sometimes, because now I've got this child, I've got this infant. I'm grateful. This is what I've wanted for so long. And we sort of throw ourselves into that. But have seen in my own life that there are dangers in burying unaddressed trauma as we move forward, and it can impact even the mothers that we show up to be, the wives, or all of those things. So why is it important to ultimately address those traumatic events?
Well, there's been so much work on this. The trauma doesn't just live in the brain, it lives in the body. And you might be able to push it away in the mind, but the body
Remembers.
keeps the
Yeah.
score.
Right.
So we need to move. Plus, grief and trauma is a very stagnant, heavy energy. It will permeate some area of your life somehow, whether it's your dreams, nightmares, your thoughts and feelings, your fears, your anxiety, a sense of doom, and you don't know why. If you have your living child, you might be way overprotective of that living child. You may not allow it the freedoms its friends have because you're just so scared that something's going to happen to that child. You, again, going back to kind of your thoughts and behaviors, could be maladaptive and dysfunctional, and you're usually hypervigilant and overly anxious and not your nerve, again, the nervous system is not reset. It's not calm. It's not really it's again, not in coherence. And so are you really attuning to your child's needs? Are you really attuning to your own needs? Are you overly compensating because you don't want to feel any guilt or sadness? And you just want to live in the present in a way that's not in the most healthy, adaptive way. You need to move through the trauma and process the trauma so that it doesn't come back and impact your life and or impact your relationships with other people.
I mean, you are so spot on with all of that. And my moment when I realized this was actually during COVID, because I had spent many years protecting my daughter. We were on pins and needles about her developmentally for years because she was developmentally delayed and all of that. And then COVID hit. And I really thought I was going to lose all the members of my family to this unknown disease that was sitting out there. And I had full on anxiety attacks. And that was really when I realized that I have to deal with these things, because otherwise, you're right, it is going to make me not fully emotionally available. It's going to make me oppressively protective of my daughter and really impacting the person that she becomes. And that was really the moment for me when I realized I had to go and deal with this myself.
Yeah.
And for me, EMDR therapy was also a very significant piece of that, to relive some of those things so that I could integrate my sort of reptilian brain and my higher functioning brain to
Right.
really calm that trauma. So,
Yes.
well, women a lot of times think that we can go to our friends and family as the people to help us with these things.
Right.
Sometimes that can be not the best. I'll
Right.
put it
Correct.
mildly. Why do you feel that it's important to have different kinds of support systems? I mean, I remember when I was going through infertility, I was talking with a person who was also going through it. And I almost say it's like having one drowning person trying to help another drowning person. And it's hard to have perspective when you too are in the middle of things. Why is it so important to work with someone who's sort of more able to be a little bit more detached and objective and have a different perspective than your inner circle?
Well, for women who've experienced the death of a baby or child, seeking support outside their immediate family or friend circle is often not just helpful, but essential for long-term emotional health. It isn't because loved ones don't care. It's because child or baby loss creates needs that close relationships alone usually cannot meet.
Yeah.
Loved ones are grieving too. Partners, grandparents, siblings, close friends are often in their own grief and trying to stay strong and are afraid of saying the wrong thing to you. This limits how much space they can truly hold for your experience. And especially when your grief is ongoing, complex, and evolving.
Yeah.
So the death of a baby child is traumatic. It's a traumatic loss. It's not just an emotional one. You're dealing with trauma, PTSD.
Right.
So it really takes a specialist in that field to really help you unpack, understand, give you the education, give you the emotional tools and the support in a non-judgmental way, of course, and in a way that helps you to heal and move forward and integrate all the feelings and the loss of what it meant to, what that child meant to you, and so that you can incorporate that into your life.
Right.
Because often, sorry. Go ahead.
No, I remember that right when I found out that I was going to be losing my daughter, the friend that I was kind of a running partner with became pregnant with a little girl, and it was like, how in the world can I possibly, speak with her about this, share with her about this? That was when that friendship just sort of fissured because I wanted to be happy for her, but how could I get outside of my grief? And I didn't want anything to diminish her happiness.
Sure.
And at the same time, my partner couldn't deal with grief at all, could barely deal with basic emotions, I remember. And so the ill-equipped. And then, you've got other people like family members who get pregnant like that and they can't relate to what you're going through. And so I think it really is so important. I also remember a family friend sent me this figurine that was so precious to them. It was a family heirloom, but it was this angel with a broken part to it. And I remember like, my baby's not broken. And, I had a really strong reaction because what they thought was a treasured thing they were sending me for support carried a totally different message to me. And it's so hard to know what to say to somebody who's dealing with loss, isn't it?
Yeah. 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 It is.
I know you're familiar with all of, the misguided ways that people try to help, but they're really not able to help. And so I agree with you. It's so important for a professional who knows much more about how to help.
Yeah, because people going through trauma have, not only they can dissociate, they can, the hypervigilance needs to be addressed. Your friends can't address that. You can have, also intrusive imagery from the past, or even intrusive imagery of your living child, of something harmful coming to them. And you can, your brain makes up things. Your brain's not your friend. I often say that.
Brain's just trying to get by.
And, you can have emotional numbing and, and there's identity disruption. Who am I? Who am I now? That I only have my one child when my other one died, and the other ones didn't come through, or I want more, and I can feel guilty about that because I have one healthy. So there's always something the brain will find to criticize you about or create a feeling that somehow you're not satisfied.
Yeah, it's so complex. And I think that's what is so important, to work with someone who can help you sort of untangle and sort through those things.
Mm-hmm.
And you use a variety of techniques, as we talked about at the beginning, the psychotherapy, trauma-informed mindfulness, somatic therapy, cognitive behavioral therapy, Reiki, all these guided meditation. What does this combination of therapies do that helps a more complete level of healing to occur?
Well, I believe in, the whole body. I don't believe we live neck up or neck down. I think we need to, again, bring in the brain and heart coherence, as I spoke about. So I like to talk about how we need to, I always go back to the regulation. I just do. If you can get the body to regulate, how do we do that? We can do that through storytelling and then capturing our sense of empowerment by the stories we do tell ourselves. So when you tell yourself a story, it becomes a belief. If you repeat it enough, you believe your story. Well, oftentimes your stories aren't true. So we need to, let's go back and let me hear I need to hear how you think, what comes up for you, where are your trauma triggers? We can take trauma triggers and disempower them so that you don't have the same emotional response to a trigger. You have imagery in your head. What do you flash back upon? Well, that's where the trauma-informed mindfulness comes in. I have techniques that help, again, diffuse any sense of emotion around those past images you hold in your mind of the worst days of your life. So, and some people are like, oh, but I don't want to lose connection. I don't want to lose that. I don't want to, they feel like
I don't want to forget, right?
Yeah, forget or lose. And it's like, you don't.
Yeah.
But you don't need to have that memory associated with distress.
Yeah.
Like we can take away the distress. Hypnotherapy is great for working out past pain in the body, issues in the body, because you have to talk, and then there's a physical aspect to the hypnotherapy I do, where it's something called hitting down. You hit down on a pillow with your emotions. You're like, I'm angry, or I'm frustrated, or I'm sad. And that helps you bring up the emotion and help you move it through your cells energetically. And it's been sitting in there. People are really often just really astounded by the amount of emotion they've been holding and not even realizing it. They report feeling lighter. They report feeling clearer. They report feeling like, oh my gosh, I didn't realize I was in such a fog, or that I wasn't thinking as clearly as I could, or, they just feel freer, I guess is a word too.
Yeah.
So hypnotherapy is really, really powerful work. I do not do EMDR, but EMDR is great as well for processing trauma. It's basically working with the bilateral parts of the brain. I can do that in my trauma-informed mindfulness, because I have you move your eyes side to side. It's very similar.
Yeah.
Or
Yeah.
where tapping also is very good for trauma.
Yeah. Yeah.
Because you're also using both sides of the brain. So Reiki is more of I don't use it as much. It's usually a request. They know I do it. They're like, can we do some energy healing? That's a beautiful way to just, be calm and re-regulate. And I can feel where the energy might be a little more stuck. And so then we can talk about, it brings up conversation, actually. It brings up a lot of conversation and working through energy centers of the body. So.
Absolutely. I mean, I know that pain is stored in our body, and you can activate that and really bring that up. I want to talk about briefly, we're getting close to the end of our time, but I wanted to kind of go to more the recovery side of this and kind of the hopeful side, because we've been talking a lot about the pain, but what I have found is that there are some blessings that come with the healing portion. And when you can get perspective on all that you've gone through, it can be very meaningful for our lives. And there's a term, post-traumatic growth, that when you go through all of these things, there really can be a new emergence and a new level of understanding. So how do you find these experiences shape us for the better if we've done this healing work?
Well, we often talk about, therapists, I guess, psychologists, we talk about how do you find meaning in this? What is the meaning making of your loss? And often women talk about, and men, but we can talk about how, giving back to the community is very important, or giving back to the community, the lost community, doing things that are somehow healing for you too, when you work with other people who you could guide them. When you become a guide for someone else who is going through what you went through, it's healing for you too. And there's so much beauty in that, I think. It also, anything that helps validate what you've been through is important. So it is creating artwork maybe, or writing is very helpful. Journaling. Even if you have a book in you, do you have a book maybe you want to write or share?
Exactly.
Leading your own support group, but letting people know you're not, a therapist, but you are a lost mom, and that you want to create community. That's community actually is probably the number one thing people can do on their own to find healing. Actually, it's very important to know that. And to really make sure, you feel safe with the people you're with, that these are people who they don't need to like completely get it, but they definitely need to hold you where you are and not try to change or fix you, but just hold space. And that it's not weird or somehow pathological even to create an altar in your home for your deceased baby. You love that baby. That was a much loved and wanted baby. You would do that with your parents. You can do that with your grandparents. You can do that with a sibling. Like you can do this for your baby, and people can choose to look or not look. And it's okay to have footprints and a candle and maybe some items that meant something to you or something during that pregnancy or since that pregnancy. And you can share the story of say your baby's name. Very
Right.
important to say your baby's name.
I agree. I agree. And I love that there are so many ways to potentially honor the child, honor the loss. And I think we realize that this becomes a part of our journey, and we become a more complete, a more evolved person, having an understanding of some of these most major parts of our lives.
Mhm.
Loss somehow gives us a greater appreciation sometimes of life. So I want to thank you so much. I mean, this has been deeply meaningful for me, and I know that women and hopefully men as well who are listening to this will find some resonance. I want to let you know that there are resources on Cheri's Choice, and I definitely encourage you, if you're going through some of this, Dr. Ivy is such an incredible resource. I mean, I'm just blown away by the depth of expertise that she has. So, I think that reach out to her, or others in the field. And so, again, I just want to thank you for being here with us. And I want to tell people that, if you have a dream of motherhood, it might not be easy, but I believe that with knowledge, courage, determination, and a village that love you, anything is possible. I'm happy to support you through that journey, and I hope that you will tune in next time.
Thank
Thanks so
you.
much, everyone.
Thank you very much.